I'm Nick Pawson for News 24 Live. I'm joined in studio by our Health 24 team, or Harry Phillips, to give us the latest stats and facts on the Ebola outbreak. Harry, welcome back.
Hi, Nick.
It's been a while.
It has.
Interestingly, the Time Magazine, or Time Magazine's Person of the Year, I believe, are thinking of awarding the Ebola fighters Person of the Year.
Yeah, well, actually,
how does that work?
It has been awarded today. So they held a public vote on their website, but that's not the be-all. They also take that and then the editorial staff decide. And yeah, they went with the Ebola fighters as this year's Person of the Year.
Now, when they say fighters, who specifically?
It's mainly the doctors, the nurses, the people on the ground. In particular, the people who have no obligation to be there. You know, people who volunteer for MSF or the WHO. Those guys who are usually from overseas have no need to be in Guinea fighting Ebola, but they just choose to do it.
Okay, good for them.
Yeah.
Sierra Leone now is, I see where a lot of the focus is now, the real Ebola hotspot taking over from Liberia.
Yeah.
Is that based on deaths?
It's the number of cases. Yeah, it's a dubious honour to have as the worst Ebola country, but they've just taken over from the highest number of cases over from Liberia. Interestingly, they've got a much lower death rate, but that's probably going to rise. It seems that Liberia is actually getting better, which is why Sierra Leone has got worse. Liberia seems to have a lot more awareness, and they're actually sort of slowing things down, whereas Sierra Leone really isn't. They're still growing at about 80 to 100 new cases per day. So it's not looking good for Sierra Leone, but it is looking slightly better for Liberia. So silver lining.
And other African countries nearby, I know Mali is also one of the affected countries.
Mali's still simmering. There's a couple of cases there. There's about 10 cases, and a lot of people being monitored. They're trying to follow that Nigerian model, which is as soon as anyone shows signs of Ebola, you monitor them intensely and you track everyone who's been in contact with them who could possibly also have Ebola. And that worked brilliantly for Nigeria. I mean, that was a stunning response to the disease, and hopefully Mali will have the same kind of success, because if Mali's a massive country with lots of open space, lots of rural communities, and if it was to break out there, it would be a very difficult thing to contain.